SBIRT is really a three-phase process: screening, brief intervention, and referral to treatment. That stands for SBIRT, SBIRT. The intervention is really about screening people who are seeking out medical care for substance use in relation to that medical care. Well, brief interventions model is based on a motivational interviewing strategy. It's a simplified motivational interviewing process. It's a simple four-step process of asking for permission, offering some feedback, giving some advice about that feedback, and developing a plan. The idea of SBIRT is that we would screen everyone at least once a year for alcohol and other substances. We find that about 78% or so are either only occasional users or complete abstainers. That only really leaves about 23% for medical clinics and hospitals to address possible risks of alcohol use. About 8 or 9% are in the low section, about 5% or so are in the middle section, only 2 or 3% are in the very highest section. So it's only really that 23% that would get further screening and possible brief intervention to the process. Being able to screen for substance use issues for adolescents, I think, is really critical. This is the time that these substance use patterns begin. If that's due to a long-standing family history in addiction or just basic experimentation. And I think it's important that we include the screening for adolescents and the services that we deliver through SBIRT to be able to navigate those adolescent challenges well. Well, SBIRT is a billable activity through Medicaid, Medicare, and insurance. Medicaid has an unlimited amount of numbers of billings, although probably over a period of time a behavioral health code would probably be better than an SBIRT code. Medicare has a limit of about 5 or 6, depending if you include the assessment or not, but usually that's enough to get things going. Insurance is very close to Medicare for as far as the number of sessions. What is critical for SBIRT is that the physician ties the medical issue that the patient came in with to their substance use pattern, whatever that may be, and how that might influence the medical outcomes of why they came into the office. That is such a pivotal point of the SBIRT process, and the physician plays that very critical point. It is their role to do that. To implement SBIRT is a really interesting process in that it's not just about training. The training and the process is not that difficult. The idea of SBIRT and blending it in with medical situations is a little bit more challenging. A lot of physicians and medical staff have a hard time initially understanding why you would be screening for substance use and the person's coming in for a sleep disorder or a flu or chronic pain. But we find that people have sleep disorders that are caused or maybe increased by a substance use disorder. We find that certainly for chronic pain, there's a lot of issues involved with that. Using other substances like alcohol ends up interacting with the medications prescribed, increasing the potential of addiction. That's one challenge. After that challenge, there's actually just practicing it and getting comfortable with it, owning the process so that it feels natural to the provider. At first, a new skill never feels natural. You have to kind of try it on and fit it into your own style. Once it's there, though, it's an automatic kind of process. Physicians will usually be hesitant about the process to begin with, but become very enthusiastic about the results as they practice it. You know, substance use is a part of physical health. It is not separate. It's just like diet. Diet is a part of physical conditions. Exercise is a part of physical conditions. Relationships are a part of all of that. So substance use is not something aberrant. It is something that's really a part of physical health. And so SBIRT really gives us the opportunity to include substance use screening, and talking about substance use should be normal. It should be usual as a part of a medical delivery system. And it really gives us an opportunity to be blending better our sometimes fragmented system, where both physical health and behavioral health people can work together in a holistic way for the patient's best wellness.